Hello and welcome to Mindset Matters with me, Ciara Ní Bhroin. The season has been all about elevating and empowering us all as women. This week is no different as we go on a deep dive down below. Aoife Harvey from Women's Health Dublin shares her wealth of knowledge around women's health and how we can empower ourselves and get whatever supports or healthcare that we need. Hi, Aoife, and thank you for coming on my podcast, Mindset Matters. We'll start a bit. Tell me a bit about you and the work that you do.
Hi, Ciara. I'm a pelvic health physiotherapist, and that means we basically look after the muscles of the pelvic floor, but way beyond just the muscles of the pelvic floor. It's like a holistic approach. So I only treat females, but some of my colleagues treat males and children as well. And basically, our role is to help people who are struggling with things like constipation, pelvic pain, difficulties with bladders, bladder leaks, overactive bladder, pregnancy, postpartum. So anything that's happening as a dysfunction in the pelvis, and that includes intercourse issues. So anything that's going on down there that women need help with, usually they're told to come to us first, as we are considered like the first line treatment. Like if you had a sore knee or a sore back, usually we don't send people straight into the consultant for a surgical consult. You'd go to a physiotherapist. So people tend to come to us first and we try and fix them in inverted commas. And if we can't, then sometimes we do need to refer them on to our medical colleagues like urologists, gynecologists, colorectal. So that's what we do. I absolutely love my job. I'm hugely passionate about women's health. Even though I work in the pelvic health sphere, there's a lot of other things that are connected in this, like hormones and go through pregnancy and birth trauma. So like it just, there's layers and layers and layers of, I suppose, knowledge I need to have and courses I go on and interests I have and how they develop. And I'm so passionate about it.
And just tell me why our pelvic health is so important.
Well, maybe it's not that important if it's functioning well. So if, like anything, if someone was listening to this, if you had a really bad back problem and you couldn't go to work and you couldn't do sport and that spiraled into losing your job and having no social life or breaking up relationships and living in chronic pain. So when things work okay, people probably wouldn't understand why something's so important. It's when it's not working okay, you know. For example, I would have women that struggle with their bowels, and that can include incontinence of the bowels. That is definitely one type of symptom where women really avoid going out to funerals, to exercise, leaving their house, you know, unless they've had a bowel movement, if at all. So can you imagine the effect that have on your whole life if you never wanted to leave your house for fear of having an accident? When it comes to bladder leaking, women may stop exercising. Again, don't want to go on a walk if there's no toilets. So again, they're not life and death, but they're massive quality of life issues. And I would have patients who, like, everywhere they go, toilet map, go to the toilet, leave their house, go to the toilet in the train station, get on the train, get off the train, go to the toilet, get to the office, go to the toilet. If they're going to have a meeting back to back, how am I going to get to the toilet? You know, if my friends want me to go for a walk on the beach, there won't be a toilet. So it becomes not obsessive for them, but really impactful on everything they do. And then when it comes to pain, and everybody hates pain. So that can include things like endometriosis or painful intercourse. Pain is something that's really hard to live with, and especially when it's chronic and it's not going away and no one can explain to them why they have it and how to help it, you know, and women are so good at putting up with pain. So things like endometriosis can take on average 7 years to get a diagnosis when you're living with this unexplained pain. And the same painful intercourse, that is going to affect relationships, women wanting to conceive, you know, living with pain, their work, not being able to sit for too long, needing to take time off work, you know. So it really affects every facet of your life and your quality of life when there is a problem and when a woman's struggling to get the solutions.
Yeah. And pelvic health issues, I think, affect a lot more people than we realize.
Yeah. So, well, endometriosis is 1 in 9 women. So even for ease of the mathematics here, I would say, you know, if 10% of women in Ireland have endometriosis, that's 200,000 women in Ireland. That is more than diabetes. Okay. And everyone's heard of diabetes. So, you know, we are really underserviced. We don't have great specialists yet in this country for the 200,000 women living with this chronic condition that doesn't go away. Bladder leaks. 1 in 3 women, a third of women after they have babies, 2/3 of women after menopause. So
Yeah.
60% of our 60-year-olds in Ireland have a bladder issue. That's massive, you know. Um, Bowel's harder to quantify because people can just struggle with constipation and not really even
Yeah.
report it.
Mhm.
A lot of people are like, I don't even know what constipation is,
Yeah.
So do I go to the toilet, but I only go once a week? I'm like, that's constipation. You need to be going at least 3 times a week, or when they do go, it's difficult to evacuate. Or
Yeah.
if they fecal incontinence, which be on the much lower side, you're talking about 1 to 3% of women, but out of everything I'm talking about, it has the most impact, as you could imagine, soiling yourself out and about.
Yeah.
Like it
Yeah.
honestly does, but it is the smallest amount and definitely affects more people and women as they get older.
Yeah, of course. And do you think, is there enough education or even information out there around pelvic health and minding your pelvic health?
I think here it's getting better. Look, I would love to be sensational, but I'm not anymore, okay? Because I think the people who don't understand things get very sensational about it, right?
Yeah.
Every woman should do their pelvic floor exercises, no matter what your age, even if you haven't had babies. I disagree with that.
Okay.
So it's a bit like when you hear menopause now. It's a multi-billion-euro commercial entity, right? So we need to, first of all, people need to listen to the right people who usually
Yeah.
don't have much skin in the game, who aren't just trying to sell something,
Yeah.
trying to sell a chair that's going to fix all your problems if you sit on it, and then pay all these influencers to say, I sat on the chair. I don't even have babies. I'm 30, but everyone should do this.
Yeah.
So what I think is that all women need to learn about their pelvic health, but different messages at different stages in life. Okay.
Yeah.
And I think that's across the board. If you try and talk to a teenager about menopause, she is not going to be interested, but she should know it exists and she should know what her mom is going through. But
Yeah.
if you're going to sit down for 5 hours and go, here's a book on menopause, it's not going to appeal to her.
No.
So I do think women need to learn more, but appropriate information for different stages of their life. I would love in schools, people say, Aoife, you need to go into schools, teach them to do their Kegels. I'm like, they don't need to do pelvic floor exercises / Kegels. They are young women. They usually don't have these kind of problems. If anything, their pelvic floor is really tight. If anything, I
Yeah.
need to be telling them that when they start having intercourse, it shouldn't be painful, that their periods should not be really painful. If they do
Mhm.
have little bladder leaks then or have anxiety over their
Yeah.
bladder, it's not actually a pelvic floor weakness. So I really feel like if I'm educating people, the cohort and the age in front of me really matter, because
Yeah.
when something makes sense to you, and it's appropriate to you, you're really going to be interested in it, and you're really going to learn. And that is
Mhm.
human nature. So I don't want to overdo it on that, but I think I would love to get into fourth years and start explaining things about periods and painful intercourse and what's not normal and how the pill affects their hormones and how hormones affect their libido and their mood,
Yeah.
And then
Yeah.
on the side, talk a little bit about maybe their mom. Then when we
Yeah.
get past our 20s, so painful intercourse is a really common thing for younger women and women in their 20s, and we should talk about that a lot more than we do. But when we get to the pregnancy sphere, that's when women start to learn about pelvic floor strengthening.
Yeah.
And I think that's appropriate. Okay. It's really the first time in your life you're like, there's a big baby. They're weighing on my pelvic floor. My blood, I go to the toilet all the time. My hormones are all over the place. I think that's a really appropriate. And we have
Okay.
pregnant women coming in to do the classes. Like they're engaging in antenatal education because they're pregnant for the first time. So they're like, tell me everything. I don't know what I'm doing. So they're going to be super engaged and wanting to, hear all the things they need to learn about. So they're a really good cohort of women that they're like, I need to learn about my body. I think that's a great time. They should be doing their pelvic floor exercises in pregnancy, from the end of the first trimester on. We've really good research about that, like
Yeah.
doing them every day and making a good practice to maintain their strength throughout their pregnancy. But we also should talk to them here about things like constipation that's really bad in pregnancy, and
Yeah.
like so many women get hemorrhoids in pregnancy, like
Yeah.
60%. But there's no little class on hemorrhoids and what to do, what's the signs,
No.
And a lot of women come to me years after their babies saying, I've had these hemorrhoids since I had my child and I'd love to get them removed, and like not understanding what they are and that they're really
Yeah.
normal, leave them alone. And, so it goes always beyond for me, just do a squeeze here and there. But like,
Yeah.
it's much easier and more sensational to be on the internet going, do your squeezes. It is.
Yeah. And do you think so? Like you say, I would have only heard about my pelvic floor in pregnancy, um, and but you're saying that we should be in schools talking about these things, and I have to say I agree, because had I known what a pelvic floor was and what it did, perhaps I would have been more engaged in minding it. And then you go through pregnancy and you go through labor, and thankfully there were no major injuries. I just ended up with an emergency C-section. But I've heard of other women where they're left with catastrophic injuries and prolapses.
So, okay, I'm going to say something here that sometimes doesn't go down well with people. The only way a woman can truly avoid pelvic floor injury in birth is a section.
Okay.
Okay? No vagina will ever be the same again, but they are amazing in what they do, Ciara,
Yeah.
right? The ability of a vagina to stretch, to let a baby out of them is amazing, right? And we cannot take that away from women. And I am not against vaginal births. I had 2 unmedicated big babies, okay? But like, it is still a phenomenon what a woman's body can do. And in pregnancy, like, it's all like when you really learn about the medical side of it, you're like, God, like we could never man make this. Like, this is, a woman's body and her ability to do everything, and fertility when it doesn't go wrong, what you learn about fertility when things aren't going right. You know what I mean? So everything is so complicated if it doesn't follow suit. So the body is amazing, and the hormones make it possible. The hormones' ability to soften everything to make it stretch, okay? But 50% of women who have vaginal births will have a prolapse. 50%. Not some women, not the odd person, right? They may not feel it, Ciara. They might not even know. It could be a small little prolapse. They're young. They may not even know it's there. That I was going to go forward to this, but I won't. My biggest issue with the health system in Ireland for pregnant women is the lack of examination of every single woman who's had a baby. Every single woman. And the great thing about social media, podcasts, talking about women's health is that women themselves are seeking it out. For me, nothing has changed except women's knowledge. They are coming to see us because as a physio, what we offer or an appointment we have is this thing called a postnatal check, right? Every woman deserves this and she shouldn't have to pay for it, right? Come in, not day one, not before you leave the hospital when you're bleeding and everything's all low and you haven't slept and you just want to go home to your bed and even your section scar is red raw. We need to see them a few weeks later or a few months later. We want to make sure their tummy muscles have closed fully. We want to make sure their C-section scar is healing okay, that there's not loads of adhesions and scar tissue that's sticking to everything. And we really want to examine their vaginas. We look what their vagina has been through. Like, imagine if you had a knee operation, okay? A knee replacement or a cruciate ligament repair, and they looked at you before you left the hospital. No one ever checked you again. No physio was offered. No, come back at 6 weeks and let's recheck this. If you have any problems, just come back in. The physio is going to be seeing you all the time for exercise. That is not what happens when you have a baby. It is mental, mental, right? And when you actually put piece to piece, a knee operation is a surgery. A vaginal birth is a natural occurrence, okay? But the trauma to the body in a vaginal delivery and the hormone changes and even the psychological aspect of having that baby in that labor, it's so unique to a woman. She's like, oh my God, like no one ever sits with her after and is like, are you okay after that? Do you want to just talk through it? And it ended in a section or it ended in this, like, and your hormones are this. Let's talk, because it's post-traumatic stress, kind of a little bit for everyone, I think. Even it goes amazing. Just to sit with her and say, let's go through that. Do you have any questions, But to then say to a woman after she's had a baby, how are you? Like, how is
Yeah.
your mental state? How is your pelvic floor? Is sex sore? Are your hormones all right? Do you want to get back to exercise? Is your back sore? Do you feel really weak? You know, there's so much to talk to her about, even if the delivery was smooth, right?
Yeah.
There's this, you're going straight into menopause when you give birth to a baby. Your hormones fall off a cliff. Some women get really anxious, get really like night sweats, libido, their brains aren't working, their sleep. Some women get psychosis. There's extremes of symptoms. Just talking to them and explaining, oh my God, you could have just gone from pregnancy hormones to like no hormones in your body in a day. And we're giving you a baby and you're not going to sleep for the next week. And you've just been through labor. For me, that is the hardest. I know most magical and amazing, but it is the most hardest thing a woman will ever go
Yeah.
through. And no one is even just explaining to her, not even supporting. So that's what I'm saying to you. Like, for me, Ciara, pelvic health isn't just Kegels, right?
No.
It is so much bigger. Like, I can't only talk about their pelvic floor. I have to talk about
Yeah.
them. Are you constipated? You know, they leave the hospital and they're like, I couldn't poo, it was so sore. Now I've hemorrhoids, a
Yeah.
fissure. I can't sit down. Everyone wants to come and visit me, you know, and I'm just feeling like all over the place. So I really think, like, in other countries, there's still a culture of the mother-in-law or the mother and the aunties come to stay with you and you stay in bed. There's all these cultures of like letting this woman just rest and supporting her with her baby. We don't have that culture. And
Yeah.
maybe some of us wouldn't want our mother-in-laws coming, our own mothers, right? We're different. But to at least have this thorough, I know. So when you think about it, I'm like, actually, like, I'd want that. But to at least have this really thorough appointment, you know, to go in. So the appointment that we would have is an hour. And I sit there for the first 20 minutes and I just
Yeah.
say to her, how was labor? Like, how do you feel? How are your hormones? And she might go, what hormones? And I explain all these symptoms. You know, you could get joint pain. You might feel like an old lady. Oh my God, I do. You might absolutely hate your husband. Like, if he chews beside you, they're like, yes, you know, just to totally validate what they're going through and tell them this is really normal. But then on the
Yeah.
physical side, as I said, check the tummy. I really want to check their pelvic floor. How is their tear? If most women will tear the first time, is it painful if I touch it? Have you had sex yet? I'm too nervous to have sex. I have no libido. I'm afraid it's going to be sore. We tried once, it is sore. So I want to talk to them about that. You know what I mean? And give them a safe space for someone to actually let them ask those questions. And then check them for prolapse and talk to them about bladder leaks and constipation and all the things that so many women are experiencing in the postpartum period. This isn't unusual. It's more common than not, you know?
Mhm.
So every woman deserves that, and not day 2 postpartum, 6 weeks, 8 weeks, 12 weeks, whatever it is. And before she's gone back to exercise, Ciara, to give her the info, we have guidelines now that GPs don't even seem to know, and some obstetricians don't know. It is 12 weeks before you go back to proper exercise, not 6. Before you
Yeah.
run, before you lift weights. Like, scaremongering as this sounds, a woman can give herself a prolapse doing the wrong exercise. She can make a
Yeah.
prolapse worse. So she could leave birth going, I was fine. And then I started running week 2 because I just felt good. And then she can develop a problem because it's too early. And as
Yeah.
physios, we are all about facilitating exercise. It is so good for a woman's mental health. It is so good to rehabilitate herself after pregnancy, like, so important to even have that time away from the family to do a little bit of exercise for your serotonin, for your strength, to find yourself a little bit. But there's a right way to do it. So again, you go in for a little knee operation, which for me is much more simplistic. You're given a booklet. You're told to do these exercises. You're linked in with the physio to rehabilitate you. You're not allowed run. You're not allowed drive, you know? And then you're
Yeah.
guided back to the things you love. Where you have a baby, it's like the baby's out, you're all alive, good luck. When we talk about the 6-week check with the GP, it is for you and the baby. And there's just no time. Like, everyone tells me that. Everyone. For the
Yeah.
best GPs in the world, there's not enough time in that appointment. Do you want the pill? How's your tear? You know, and
Yeah.
GPs are not gynecologists and GPs are not women's health physiotherapists. You know what I mean? They have their own massive skill set. So it is very brief and it's not enough.
No. So just going on from that, do you think there's a gap then in supports for women medically and holistically, at the different stages, not just pregnancy, but at the different stages of our lives. So we learn about these things.
Yeah. I mean, the hard part is, right, there's a massive gap in service in all elements of the health service. And I've worked there, they're under massive strain. Okay.
Yeah.
You don't hear this stuff in the news, recruitment embargoes, someone goes on mat leave, they won't fill them, someone's on sick leave.
Yeah.
They are always under massive strain. So the doctors and nurses you meet in there are amazing, but the
Yeah.
system is the problem, right?
Yes.
So
Yeah,
there's a
exactly.
gap of services. We can't offer this to the women that need it. The same with endometriosis, a huge gap in service. So health insurance and private healthcare to me is so important for things like this, because it's not life and death. It's not going in with a heart attack, right? But that's how you get seen quicker. That's how you get to choose who you see and how good they are and their experience and all that, right? But where do we get the education is the hard part. So women need to come forward with a problem to seek help. Unfortunately, that's why I think after babies, everyone should just get examined rather than knowing there's a problem. Like, they should just be like, you are
Yeah.
coming in, we are planning this.
Yeah.
But other than post pregnancy, for any other age of life, young and old, women need to go to seek help. And if they sometimes go and do build up the courage to talk about these embarrassing, intimate things for them, which is why it can take time, then they might say it to the wrong person. They might get the wrong response. That doctor may not, in some cases, pursue anything, might give them flippant advice, and that's the end of it. So it is where things like podcasts, there's so much more articles in the papers now on women's health. There's so many more things on social media. I do love that, because it means women are hearing things. And they're hearing, oh, I think I have a prolapse. I didn't know what that was. Or I'm really struggling with my bowels and I'm going to go back to my doctor. But our GPs are our gatekeeper. They're the ones who are going to refer you on. So it really depends. You build up the courage to go in. Do they just say to someone, bad constipation, oh, here's a prescription. Oh, we'll send you for a colonoscopy. Oh, that was clear. Oh, well, so for me, and again, what is good about physios in the public setting is you can self-refer. You do not need a referral to us. You do need one for a gynecologist or colorectal, like you do. So you don't need a gatekeeper for us. So women come into me and I'll be like, I'm sending you here. I'm not happy with that. This is what this is. But women coming to us now more, Ciara, than they ever did before is because they know we exist. And that is the first step. Knowing who's out there, what they can help with, what problems could I have, where do I go? And then going to the right healthcare professional, build up the courage to go, and then go to someone who's like, I'm going to help you. And genuinely, Ciara, that's what leaves my clinic every day. Like, you listened to me, you're explaining what's wrong with me, you're explaining the possible things that we need to do or possible things that could be wrong beyond this. And Aoife, you're going to send me there if I need to go. So I genuinely get so much job satisfaction out of that. Some people times I only see people once, and it's not even to do pelvic floor. I'm like, I explain at their level in language they understand what is going on and what's not normal and what we need to do. But how do women find me in the first place? Thankfully, they found me through social media or a podcast or an article in the paper. So I think that education is not going to come through the health system. And even it's not easy for the health system to educate people. Like, I understand being in there too, how do we reach the masses? You know what I mean? It's not easy. So I really love the media's focus on women's health having changed in the last few years. And I hope it doesn't pull back. I do see it pulling it back a bit from the menopause days. Like, there was so much women's health and social media. If you said the word pelvic floor, it went everywhere. So I don't want to see that pulling back, because nothing's changed. The amount of women that need us hasn't changed. The amount of women that need to hear these information has not changed, and it won't change. Unfortunately, as a gender, we're going to struggle with these things much more, and we're going to struggle with our hormones much more. So we should never stop talking about it.
Yeah, 100%. And that's the whole thing around, wanting to do this interview, is that knowledge is power, and we can empower ourselves by taking this knowledge on board and seeing the right person. And I'm going to throw another term in there, because menopause, brilliant, loving that it's getting the coverage it deserves. Matrescence. It's out there, but I don't think it's as widely known as menopause. And I think that's where I was going with the gap in knowledge, that if we knew more about it and if we didn't have to go and seek it out, because sometimes you don't know what you're looking for. But if we were taught more about how our bodies functioned, that we're very different to men, it's not a one size fits all. We have different hormones. Our organs function differently because of the different hormones. And that if we had that at an earlier stage, would we be armed then to mind ourselves better? I don't know. Would we?
I don't know because do you know what, Ciara? Do you, Ciara, actually want to explain what matrescence is? Because you're very articulate.
God, I don't know, am I? So it's that shift in hormones. From the moment we get pregnant, I suppose that's when it starts. And after you have your baby, that's the single biggest drop in hormones that women experience. So it's the physical, the hormonal, emotional, psychological, the socioeconomic element of becoming a mother. And it's
Mhm.
all those things that impact us, impact how we feel we look, and all of those changes. Like, if I could describe becoming a mother, don't get me wrong, I loved it and I adore my child. I waited 7 years for him. But Christ, it felt like being hit by a fucking train, you know? Like, it's
It was the
huge.
single most life-changing moment, and
Yeah.
for me, look, no mom would disagree with this conversation, okay? So we're not trying to spin the negative. What we're actually trying
No.
to do is talk about the mother, right? So we know, like, naturally when you have a baby, your focus is the baby, every visitor's
Hmm.
focus is the baby, every
Yeah.
medical appointment is the baby. It's all about the baby, and that's your baby, okay? So I'm not
Yeah.
taking away from the fact that all you care about is your baby, but that doesn't leave much room for caring about yourself and
Hmm.
actually considering yourself and other
Yeah.
people to consider you. So I was doing women's health physio before I had my first child. But being pregnant and having my first child is what made me change my whole career into women's health. Okay.
Okay.
So
Yeah.
matrescence is what literally, but it's what makes other women give up their jobs and try and set up a little business because they don't want to go to work and not be around their kids. And
Yeah.
you know what I mean? So it is the most single life changing thing, whether it's to do with your job, your relationship with your friends, your relationship with your family, your relationship with your husband, your relationship with yourself. It is the biggest,
Yeah.
most changing thing in your life. So when we talk about the hormones, like pregnancy hormones are massive. Like first of all, they're surges. They make you get sick. They can give you pelvic girdle pain. They can make your skin, hair, and nails look amazing. They can give you insomnia. You can be buzzing. I always say to women at 31, 32 weeks pregnant, you will have the most hormones you'll ever have in your life, right? Forget
Yeah.
puberty. Never have so many
Yeah.
hormones. That is when I came up with business ideas. I mean, I launched a business that then afterwards was like, but I was like, we need to do this in that moment. So your body changes, your hormones change, your sleep changes, your brain
Yeah.
function changes, and you're still trying to work usually full time and get through it and enjoy
Yeah.
it. But then when you have your baby, is literally when I talk about that going to menopause overnight, that like is like a woman going in for a surgery and they remove her ovaries, like I'm waking up in menopause. But you actually have a small baby at the same time. So you're
Yeah.
becoming a mom maybe for the first time, right? And your hormones literally are gone. And that's what we should warn women about. Can we make a
Yeah.
difference to that? No. We can't stop that happening. But we
No.
can stage them. I think that's why the placental capsule things are really popular, but we really don't have evidence for that. So I just can never
No.
comment on it. I'm a healthcare professional. Like I can't recommend things. Yes, maybe should we be on more trying to take more supplements? I didn't, and I probably should have. Are we getting our iron levels checked? Like so.
Hmm.
There's very little kind of input from anyone. We're just kind of struggling through, but we're also in this bubble of, oh my God, we're parents. Wow. And like, oh gosh, like this is scary. And what do we do with the baby? And you're trying to learn how to be a mom and learn your baby who can't tell
Yeah.
you anything and maybe learn how to feed. And that's not going well. You're just so obsessed with that. And so for me, what's going on with the mum is massive in its own right. But when you put this tiny new baby, that's your world on top of it. Like that is an
Yeah.
impossible thing to juggle. So I don't even know how we prepare women. And again, when I talk about who's sitting in front of me, when I have talked to pregnant women, I try and talk to them a little bit about the postpartum,
Yeah.
But when you're pregnant, you're pregnant. So you're living in that pregnancy moment. What you want to talk about is labor and how big the baby is and
Yeah.
nesting and your hormones and your bowels. It's really hard. Like, it's like going to a breastfeeding class when you're pregnant and you don't have the baby there to breastfeed. It's just not
Yeah.
like, it's so hard to learn something you're not living.
Yeah.
And I really think that's human nature. And I'm really conscious of that when I talk to people in front of me. Like, if I talk to a woman who's pregnant about all these hard things about postpartum, she might be like, God, you're scaremongering me. You're trying to
Yeah.
freak me out with this. But when I talk to that mom who's had her baby, she's like, I feel so listened to. I feel so validated. This makes sense to me because I'm living in this moment. And that is, I suppose, what's always hard is giving people the message when they need to hear it at the right time.
Yeah. So to look at things that we can do at the different stages of our lives, like what would be the top things to mind our pelvic health at different stages?
Okay, well, a different state. And are you talking right till older years or?
Yeah, so like throughout a woman's life and all the different stages that we go through.
Yeah.
So you were saying that, you wouldn't go into a school and talk to 16-year-olds about menopause. You wouldn't tell
No.
them to prepare or how to prepare. So, the
No.
age appropriate.
Yeah. So age appropriate things would be, look, education's number one at all different ages of life. If you're
Yeah.
educated about a problem, there's practical tips. So you need to know, I have this problem. What is this? What can I do? So education is number one. And my role as a physio, I think that's my most important role beyond fixing a pelvic floor, because again, I have a problem. Here's the solution. Go and act on it. It's going to make a massive difference. Okay.
Yeah.
Young people, I think where we should come in at is, again, learning about painful intercourse because it's so common, but like how to relax their pelvic floor, stress level management, hormone management. Okay. I came from an era where we were just all on the pill. That has completely changed. And maybe TikTok has changed it. I don't know. So many
Yeah.
younger girls are like, I don't want to be on a pill. We were probably masking problems our whole life. We could have had low mood, weight gain, low libido because we were on the wrong pill. We could have had
Yeah.
endometriosis, but we didn't know. We could have had, like, even fertility. You're trying in your teens and 20s maybe not to get pregnant and you don't even know there's a fertility issue. So I think I would love to see some more male contraception. There is progress in that area, but there's not much interest in it from the pharmaceutical companies. I would love if the shoe was on the other foot and that women are so much more complicated. Like, our hormones are so much more complicated. We could be going through way more than we don't know. So I would
Yeah.
love the younger girls not to be doing Kegels and no one ever to be telling them to do Kegels. It's for them about relaxing their pelvic floor, feeling like they're relaxing their stress in their life. As younger women, we are way more stressed and up to high dough, as we would say, and looking at their hormones and their periods. Okay. And that is, now nutrition is massive. And of course, in younger girls, is more like eating issues. And like, I ballooned and weighed up and down, things like that. But like, I had terrible nutrition at that time. I do see there's a change again. Like, we do joke, like the Gen Zs are not out nightclubbing. They are eating acai bowls, protein shakes, and they're in the gym, right? Maybe it's not all perfect, but God, it's better than what we were doing. So they really are. Like, the pubs are going to all close down. So it's a different era, different focuses. I keep joking. Like, when I was in my 20s, like 90s rave music was they're all into country music. Like, you're just even shows.
I know.
Way more
I know.
American influences too, for the good and the bad of it. So
Yeah.
younger girls need to learn about nutrition. But again, I'm like, does a teenager really want to listen to what's healthy in nutrition? Like, I don't know. Like, I didn't want to hear about it, but I probably would have liked to hear about periods. And I probably would have liked to hear about sex beyond this is what happens, It
Yeah.
should not you, blah, blah, blah. You know what I mean? Like, properly talk to them. Then when we come to pregnancy, I suppose that's when we should be talking about things like coming off pills way before, tracking your cycles, what's normal. You know what I mean? Where to go for help if things aren't working, how long you should be trying for to get pregnant. And then when they get in, so there again, there's no pelvic health side of this. That's not like, do your Kegels, it'll help you get pregnant. Like, women have come into me before saying that, and I'm like, no, but I've talked to them way more about hormones and, how their cycles are looking and their periods and what's normal around around that. Nutrition, again, really important for hormones. When you get into pregnancy, we should be telling women to do their pelvic floor exercises during pregnancy. We have loads of evidence for that. But we should also, again, be minding their constipation because it's really common. Their hemorrhoids, trying to avoid them, really, really common. Pelvic girdle pain, we cannot stop it. Okay, hyperemesis, we cannot stop it. These are pregnancy-related things. Some people are just genetically dispositioned to do it. When it comes to the end of pregnancy, how we teach a woman to birth is really important. So I do an
Yes.
appointment where I go through the birthing positions, the not straining, the not pushing. There's probably borderline a little bit too much medical management now, too much induction, too many epidurals, people on their backs pushing, can't feel. How are you going to learn how to give birth while you're giving birth? You kind of do, right? This is what's great about no epidurals, right? I had no epidurals. It's really sore. But like, people don't need to coach you to push. People don't need to tell you, push now, keep pushing and pushing and pushing. You can feel it. You know what I mean? You can feel if your body's not in the right position. You just have these natural instincts. But anyway, there's so many more epidurals. Lots of times it's because there's more induction as well. Older women, IVF, lots of reasons why there's more induction. Some of it's needed, some of it's not.
Yeah.
We could look at that as a whole thing on its own. Like, you induce them, they get an epidural, they struggle to push, not push, but they can't listen to their body the same way. You're straining. We can cause birth injuries. We are older having babies, Ciara, that increases your risk of everything. Okay.
Yeah.
Things stretch. It's harder for them to recoil, right? It just is, So women used to give birth way more in their teens and early 20s. They were married in their early 20s. There's a total shift. There's so much more fertility treatment now, which is amazing, because women back in the day, if they didn't get pregnant, they just couldn't. So thank God there's more fertility treatment. But we do look at like age and fertility treatment and then induction, all of these things. So it's never black and white. Like, it's not just, oh, you gave birth on your back, oh, you got an epidural. It's like a whole barrage of things. And that's where it can't just be sensationalized into, if you birth this way, we can promise you won't get an injury. I had a 9-pound and an 11-pound baby. Like, I birthed without epidural. My babies were massive. You know what I mean? So there is risk factors that we can't negate first. We can't just say, do your pelvic floor, don't get an epidural, and I promise nothing will happen. But we reduce the risks. If you do your perineal massage at the end of pregnancy, if you try not to birth lying on your back, if you give birth on your side, even with an epidural, it's better. If you don't have an epidural, try and give birth kneeling on all fours or on your side, So, and when you're pushed, try not to strain. So we can really teach and help. And there's really good evidence to reduce the risks, but we can't negate all risk. We just can't. Then for our postpartum moms, okay, if you have a prolapse, Ciara, you've got a prolapse. So we are seeing that prolapse there. We can identify the prolapse, but we're not going to go, oh, we're just going to shrink that now by doing your pelvic floor, So again, there's way more research coming out. We use these things. Pessary rings, we put in a pessary earlier, right? So if you put in a pessary when a woman is 6 weeks postpartum, maybe we could reverse that prolapse. Instead of just letting her live with it, lift her baby, lift her toddler, try and get back to exercise, we need to look more at preventative things. So catching people early, giving them advice, and maybe intervene early. There's actually a lot we could do, you know what I mean? But it isn't just a case of Kegels. It's never just a case of Kegels. And even though we prescribe the Kegels, or same thing, pelvic floor exercises, we do find that women, when they've had their babies, are not compliant because they're so busy. Like, I know I should have been doing them. So again, it's this creating this space for a woman, like, to do the things she's supposed to. Like, it's really hard. If you had the knee injury, you'd be off work, you'd be bored, you'd be at home doing your exercises 3 times a day. If your knee wasn't doing good, your consultant surgeon would say to you, have you been doing your exercises? Have you been doing this too much? But when you have a baby and you're given homework, it's like you don't have the bandwidth for that. You're like, I don't even have time to poop. I don't have time to shower. Now you're asking me to do all this other stuff, So we understand compliance is really poor, even though they come to see us. So there can be, I suppose, a mental lift. And I really find women in their 40s, is their kid, like, on average, it depends what age you have your kids, but in perimenopause, that's when they're like, okay, like I'm feeling all these changes in my body and I want to do something. I'm going to the gym, cold water swimming. I'm going to start doing therapy. I
Yeah.
need to look after myself. It is the women of the, can I curse on this podcast, Kira?
Go for it. Yeah.
Okay. So it's like, well, the we don't care or we don't give a fuck era, right? It
Yeah.
is women are starting perimenopause and menopause being like, what about me? Things aren't
Hmm.
going right with me and I'm seeking help. And
Yeah.
there's a kind of change in your confidence, right? In a different way. Your body is changing. And sometimes that's not going down well. But it's like, I need to look after myself, and like I've looked after my family and my kids and my husband, and I want to look after myself now. And they
No.
do start
Yeah.
to engage in more things. And when they come into me and they've bladder leaks or I see they've a prolapse and they're trying to get back to exercise or running and now the bladder's getting in the way, they're like, I'm so sorry. I never went to anyone after the babies. I was told to do these exercises. I never did them. And I'm like, I'm always like validation. I'm like, you're a mom. You've had like 1, 2, 3, 4 kids. There's been no space for you. You needed to do this, but you just couldn't find the time or the motivation. And like, I'm not here to blame you. Like, you're a
No.
woman and that's why this is happening. It's not fair. What can we do now? What about hormones? What about vaginal estrogen? What about a pessary? Like, we need to find solutions. We're never, ever, ever going to blame the woman, because it's just our bodies are constantly going through so much. So in that perimenopause, I really want, where's the education there? I want women who need HRT to get HRT. I want women to realize what's going on with their body. If they're struggling with their mood, their relationships, their pelvic floor, why this is happening. What can I do? How can I be proactive? How can I start to find time and space? I think it's when we become healthy. I'm going to speak for myself. My diet has never been better. My focus on exercise has never been more than it is now. My
Yeah.
sleep is shit because of my hormones. My mood can be all over the place. But I'm on HRT. I'm in my early 40s. I'm like, I'm not putting up with this. Like, I'm in an era and I'm like, I need to be proactive for me because no one else is going to look after me. And I need to find the right doctor and I need to find the right physio and I need to find the right gym where I feel comfortable. And I need to do what's right for me and look after me for the benefit of my family and the benefit of me as I get older, like for older
Yeah.
me.
Hmm.
So all this talk about menopause and perimenopause, I think is really important. It's not even a 1 year postpartum. At 2 years, they say it takes your body and hormones to really recover after you have a
Yeah.
baby. Okay. 2 years.
Hmm.
But perimenopause is 10 years,
Yeah.
So I have 2 small kids that still depend on me to wipe their bums after a poo, one of them anyway, who still wake up in the middle of the night, who still need help getting dressed, doing
Yeah.
homework, dropping them to sports. Life is still busy, but I need to prioritize how I can carve in time for me and really focus on me so I can be a great mom and be a great
Yeah.
businesswoman and look after my patients and give the world what the world is going to take from me anyway, So I need to know about hormones and I need to know that strength training is so important for me and I need to know an early bed is important and I need to know my tolerance for alcohol is absolutely on the floor, and I need to know my diet and my microbiome. And again, my diet has never been so good, even though I weigh more now than I did in my 20s, So it sounds all doom and gloom, but like this education piece, it's like we all need to learn what's going wrong so that we can find the solutions. So
Yeah.
there will be women that don't experience any of these things. There'll be women that found pregnancy amazing, that their birth was perfect, that they got back to everything they loved. They took to motherhood like a duck to water. They never experienced a perimenopause symptom, But I'd say the number of women that can say that is probably like 1 or 2%.
I
Like
was going to say, like, who are you?
And then what's really annoying, Ciara, is the comparisonitis, which we always do as women. Like we just
Yeah.
always do. We
I
can't
know.
help for the good or the bad. When we do look at some things on social media, women that seem to have it all,
Yeah.
oh, she had her baby, she's back running. Oh, look at her. She gets her makeup on every day and their hair is perfect. It's usually extensions, they get their makeup for free off people. So they might have way more help behind the scenes that you don't see,
Hmm.
or they're not sharing the reality. You know what I mean?
Yes.
But it's not it's hard for us even to look at our friends who has a baby that sleeps, and you know what I mean? It's so
Yeah.
hard not to compare. Or if you're having fertility issues and your friends on are fourth, like it's just so hard. But no one has it, I suppose, easy in inverted commas. And that's why women's health, it's all about talking to your friends,
Yeah.
talking to other moms, talking to people that are living the same experience as you at that time, you know?
Yeah.
And when you do get into your 40s and 50s, you will become obsessed with the hormone stuff. Like you, if you're not now, it's because it's not your life now, you know?
Yes.
So it's really important that we always know what's coming next for us, but to live in the now, enjoy it.
Yeah.
But when we have the struggles, we're going to be the ones who are trying to fix ourselves, you know, like no one else is. So where do I go
Goodness.
for help? What do I look out for? You know, when will I need help, or is this just a phase? So really keeping conversations open and talking to people your own age and women your own age who are going through it is probably the most important. Like they are your little village, you know.
Yeah. Yeah, that's so true. Like giving yourself permission to look after yourself.
Yeah. And see the way I'm hardly talking about pelvic health, because I'm not just saying when you're a teenager, do Kegels, when you're in your 20s, do Kegels, when you have your babies, do Kegels, when you're menopausal, do Kegels. And that's where
No.
my learning has taken me. Like, I deal with bladder problems, sex problems, bowel problems, prolapse problems, vagina problems all the time. But it's not just about doing a Kegel. It really is
No.
your nutrition, how easy your bowels work for you. Are your hormones having an effect on this? Is there physical things? Is there lifestyle things? Is it an age related change? Like, what is going on? You know what I mean? How can I
Yeah.
help you? Yeah, I can get you to do exercise. I can put in a pessary. I can teach you. But like, it's all about the education and giving women a safe space to be heard. Like, let's talk about things. You know, I was at a conference recently. How many women go into a healthcare professional, and they in Ireland could be mortified by this question, and someone said to them, how is your libido? Like, how is your desire? Can you still orgasm? Like,
Yeah.
is it part of your life? Do you want to talk about that? You know what I mean? That is a massive. We do say with men, if they had erectile dysfunction, they would be like in the A&E. You know what I mean? If their penis like was broken, like if they were leaking, it is much less common for men. It's usually when they're older, they prostate issues. By the way, when they have a prostate issue, the nurse comes in to talk to them about their bladder straight away, you
Yeah.
know? So the service they're provided is so different. And none of you realize that. I realize that working in the health system. They're told
Uh-huh.
about the problem before it happens. And they're usually in their 60s, not
Yeah.
30s, you know?
Yeah.
So, you know what I mean? Like we can help, but I don't want to just sit here and tell everyone listening to go and do a pelvic floor squeeze every day. You need to
No.
go get examined, find yourself with someone comfortable, talk to them about everything. And if they can't help you, get them to refer you somewhere else and take everything seriously, because there is
Yeah.
solutions.
Yeah.
One other tiny thing I'd like to add for the breastfeeding moms.
Yes.
Um, Breastfeeding moms will usually not get a period. Sometimes they do. Okay. But when you don't get a period, you don't ovulate. And that is like menopause. So for our breastfeeding moms not getting their period, they're going to feel lower in hormones for much longer than for women whose periods come back. Okay. Or if a mom is formula feeding and her period's back, usually at 10 or 12 weeks, she will start to feel like her hormones are back now, and she's going to feel different for that. Our breastfeeding moms, I would meet moms who haven't had a period for 2 years. Okay. Just to
What?
know that while you're breastfeeding and you're not getting a period, even though we say it's
Yeah.
not contraception, you are going to feel menopausal symptoms. And I just want to list a few, and then I want to talk about vaginal estrogen, then I'm done. Low
Okay.
hormones in your body can make your pelvic floor symptoms worse. So I will often say, yes, you have a bit of leaking, but when your period comes back, it's probably going to get better. When you prolapse symptoms, even though you can feel this heavy, draggy sensation, like a tampon in your vagina, especially after lifting or walking or running, that usually improves when your hormones come back. I'm not saying it shrinks, it doesn't, but the symptoms improve. Okay. Other things women can experience: night sweats, feeling hot, irritability, mood swings, sleep disturbance, sore joints, sore thumbs, sore heels, sore knees, skin changes, hair changes, right? Itching. Okay, itchy skin, itchy
Yeah.
ears, dry eyes, right? But in the
Uh-huh.
vagina, which is my area of expertise, if you're experiencing painful intercourse, and it's not from your scar, because the scar from a tear in your vagina should not keep going. Or let's say you had a C-section and you're like, why is my vagina sore? Painful
Okay. Yeah.
intercourse, bladder symptoms, prolapse symptoms when you're postpartum. If you're breastfeeding and you're not thinking your period's going to come back for all the months you breastfeed, vaginal estrogen is brilliant. We don't have research, we don't have guidelines, but it doesn't go into your milk. It doesn't go into your bloodstream. If it goes into your milk, it's tiny. Like, it's tiny. There's research to show that a little bit goes into your milk. I'm like, you have estrogen all over your body anyway. Like, so who cares if it goes into your milk, right?
Yeah.
Vaginal estrogen can be so good for pelvic vaginal symptoms while you breastfeed, because we don't want you to stop breastfeeding. We don't want you to go, oh, this feels worse because I'm breastfeeding, or I just can't have sex for a year and this is affecting my relationship with my partner. Vaginal estrogen can be really, really good. Okay, so talk to P about it. You only need it while you're breastfeeding, then you don't need it afterwards once your period comes back. And also, just lastly on the hormones, for some of my breastfeeding moms, even when their period does come back, when they fully weaned off breastfeeding, 1 year, 2 years, whatever, they still feel different again. Like, your hormones change again. So if you're feeling like that matrescence period, like I'm 1 year postpartum, hormones are massive. So for our breastfeeding moms, some of them love the hormones in breastfeeding. Some of them don't feel any different, and some of them feel a massive difference. And we just want to explain why to the breastfeeding moms, and that if you pelvic floor dysfunction, as well as seeing a physio, doing your Kegels, maybe getting a pessary, that vaginal estrogen can be really good. And we just don't want you to just have to suffer with symptoms while you're breastfeeding, because we just want you to breastfeed as long as you possibly can and not let that get in the way. There are pelvic health physios all over this country. Irish Life Health Insurance fully cover the cost of your first appointment, now your postnatal checks, which is an hour. And most give physio like refund or reimbursement back. I know it's expensive, but even one appointment could massively change everything for you. If not, your GP refers you back into the hospital. We exist in all the hospitals. It's just there's waiting times. So as a woman, say, one of my priorities when I have my baby is to actually go and get a checkup rather than waiting for problems or assuming there's none. Really, every woman should have that.
I hope this episode has gone some way in closing the information gap around women's health. That's it for this season. I really hope you enjoyed it and that the information and stories shared helped to elevate and empower you. Thank you so much for listening. You can keep an eye on my social media accounts to find out when I'll be back with season 3.